Hey there, how are you? I'm Tom King from tkpt.ca. I'm a personal trainer in the Ottawa, Ontario area. I love training, I love helping people, I love helping people improve quality of their lives as well as rehabbing some injuries as well sometimes. And one of the big components to rehab is regaining mobility. And mobility is just the actual movement of a joint. So a couple of different aspects that you can think about there is that you have a hyper versus hypomobile joint. So hyper means that there's too much movement there, and hypo means that there's not enough movement there. So yeah, I've learned these things over the last 6 months or so, and it's really reinforced how important those two components are to a lot of my clients, and it's helped me help them. So where did I learn this stuff? Well, definitely I've learned it from this guy named Jim Bellotta, and Jim teaches a course called Soft Tissue Release. Here's the manual there. And usually that kind of stuff is used with massage therapists, physiotherapists, chiropractors, those kinds of people. Now I'm a personal trainer, so I've tried to bring it into my clients because I really feel as though it can make quick, immediate changes. For example, I had somebody come to me in September that had tight IT band syndrome, and that was September 1st. By September 12th, she was able to run 10 kilometers without any kind of knee pain at all. And so it was through the soft tissue release and the mobility improvements, but it's also the strengthening components as well that are involved with that kind of stuff. But anyways, the other big component that I've also read too is called Stretch to Win. Now, Stretch to Win is a really good book. It's a system that you can take an entire course on. You know, it costs a boatload of money and stuff. I read the book and I got a lot out of the book itself. The big thing between both book and the course that I've done, the soft tissue release and the Stretch to Win, is that they both talk about the active ranges of motion, not necessarily focusing on the static aspect of things, not static holds like I've talked about in some of my other videos, but looking at regaining ranges of motion before activity, before a workout, before a game, before a run, but regaining ranges of motion. So yeah, now one of the other tools I really like to use here, this is a travel roller. This is my wife's. I don't have one right now, but I like to borrow it. Now you also see foam rollers behind me here as well, different varieties of foam rollers. Now the travel roller is really handy because while it's really small, it's compact, it's really narrow, so you can take it with you wherever you're going, to the field, to a hotel. It doesn't matter, you can always have it with you essentially, okay? Now the other big component that I really like with this too is that it's got a hidden compartment inside. So you can see I'm opening it up here and I can pour a bunch of stuff out like crazy and there are balls going everywhere. So the foam roller is really good, but inside you can also store my yoga strap or my elastic band that a lot of CrossFitters like to use. I like yoga straps because I like yoga, and that's just who I am. Feel free to use whatever tool you need to, though. Okay, now the other component here are the balls that I talked about as well. So I have a variety of different balls here. All are different densities, and each density allows me to get a little bit deeper into the specific areas that we're talking about. So as a massage therapist might go in, they'll probably use their palm to get a general feel of the muscle tightness and have an idea of kind of what's going on, right? They'll improve the blood flow, they'll warm up the tissue, and then they get very specific with their thumbs or their elbows or a couple of those knuckles getting right in there, right? Getting really specific. So that's where the foam roller comes in. The foam roller is really good. Big, broad surface, okay? Really good for that palm-like feel. Now, as I get more specific or I need to get further release and mobility improvements, that's when these balls are coming in. I'm going to start probably with the softest ball, okay? Work into something that's a little bit tougher and even more tough, and then I'm going to go into a lacrosse ball. Lacrosse balls have very little give, whereas this guy here has a little bit more give. You could also use things like a tennis ball, then progress to practice softball or baseball, and then go into the lacrosse ball, okay? Whenever I teach my clients here, this is exactly what I do, is I say, listen, I need you to go out and spend $10, $15 on these little pieces of equipment, okay? It's really important. Yeah, the foam roller is going to be a little more expensive, but this is going to be your best friend for the next year that you train with me. Why? Because it's going to allow you to improve ranges of motion, improve blood flow, prevent injury, rehab injury. It's a huge component to anybody's training. I spend the first 2 sessions just focusing on mobility and just focusing on teaching them how to use these pieces of equipment properly. Okay, so moving forward, now what I'm specifically going to talk about today is the hip mobility and the aspects included in that. Okay, so as I come up here, if my hip is really mobile, I'm going to have great range of motion. I'm going to be coming up and down and doing all kinds of great things like that. I'm going to be able to come forward and back and do all these great ranges of motion through here, okay? Now, what happens if that hip doesn't move properly? Then you're going to lead to compensation of things. So if my hip is really tight and I can only come up to here, okay, but I'm playing sports and I need to be able to get a little farther over, then what's happening is that I'm getting arched the spine, and the back has to do a lot more of the work than anything else. Not what I'm looking for. because that's going to lead to overuse of a smaller joint. Those vertebrae aren't supposed to be meant to use a lot of mobility. Look at the mobility you can get out of the hip, right? So if this is a hypo, really stiff joint, hypomobile, then something else has to be hyper, has to work a lot more, hypermobility. So in that sense, just by improving hip mobility, it's going to have a positive impact, A, up the chain, but also B, down the chain throughout everything else. I've improved the hip, my knee will improve, and my ankle improves as well. So, huge chain reaction events happening here. Okay, so let's actually get into more of the practical part. Enough of this theory stuff for sure. Okay, so now, like I said, I want to warm things up with that general touch of things, okay? So I'm going to use the foam roller to do that, or the travel roller. So as I do this, I'm going to start with my legs straight, and I'm just going to get a general feel. Rolling on that glute max, okay, so that meat of the muscle, going into more of that corner of the back pocket kind of idea, and that's where the glute meat is. Sometimes there's a lot of tenderness in there, but I'm also going to be rolling onto the side of the hip, okay, in between that greater trochanter and the pelvic shelf. You're going to find some other fun spots in there as well. Okay, and that's your glute min. It has anterior, forward, as well as posterior, backwards, or back parts of that muscle. So when I look at the hip again, we have that glute max, big cheek, right? Then you have your glute med in here, and your glute min that rolls in here. Then you also have your psoas muscles that are in here, right? Then you also have your groin, your adductor muscles, and they're really important as well. But usually, most of the issues lay in the actual exterior hip muscles, right? So these guys, the lateral edges. So as I do this, again, I'm going to get you to watch my hips as I do this. So I can start here, work my hip flexor a whole pile, right? Get out much of those knots. You can see that I'm kind of being more active with it. I'm not necessarily pausing and holding on it. For sure, you can pause and hold on it, wait for it to release, but then I'm going to also continue to move around, okay? So if I flip views here, now I've gone from that hip flexor straight on, and now I'm rolling along that side of the hip. And I'm going to go into that back muscles, right, into those guys and through there. Okay, I'm going to continue to put that hip through the range of motion so I can cross over like I did in my other video and really focus in through here. Okay, so that's good. Again, general use, right, so I want to start here and progress to the other points. I always want to start here, generally speaking, to increase the blood flow, right, increase the temperature of the muscle, starts delivering some of those nutrients and getting rid of some of the products that we're breaking up. Okay, so from there, this was very general, right, very big, broad surface that we're dealing with. Now I want to get more specific, and I might transfer over. And I've been doing this for the last 6 months or so, so I'm ready for the lacrosse ball. This is your first time ever doing this, please go to a softer ball. Very important that you do that. If you go too hard of a surface or too intense and it's knocking the wind out of you, you literally cannot breathe through it, then it's too intense. You're going to have a negative reaction. You're going to have a stretch reflex. So instead of getting softer, it's probably just going to continue to fight you and firm up and do more damage than you want. So definitely make sure that you're doing this in a progressive manner. Start with the foam roller, then go to soft, medium, and then harder surfaces as you go, okay, or densities of the ball. Alright, perfect. So here what I want to do is find that back corner of my jeans pocket where I keep my wallet sometimes. Then I'm going to be rolling around on that ball looking for any of those tender points. Okay, now I can mediate the pressure with my upper body and my hip, and or not my hip, my foot and my other foot as I go, so I can lift up and down, putting as much pressure as necessary to get the reaction out of it. I know I'm at a good spot if you feel it. You'll know what I mean. Okay, once I'm there, I'm just going to chill out and wait for it to release. I'm just going to continue to breathe. And as I do so, I really want to ensure that I continue to breathe, like I said. Alright, so then moving forward, or rolling forward I should say, I definitely want to continue getting some more of those side hip muscles. As you can see here, I'm rolling forward onto that ball, right into that hip flexor. Okay, really trying to release some of that pressure that's in there. You're going to roll over probably the TFL and everything else that's in that area, and that's great. Okay, that's just going to make everything else better. Alright, so that's really good. Now let's say I had a little spot or a big knot in there that just simply isn't breaking up. So then what I probably want to do is find that big chunk of it, right? And I'm going to pause and hold on it, and then I'm going to put my hip through some ranges of motion. It's going to just kind of rub over it, just like the massage therapist does, rubs over that area over and over again until it does finally start breaking up. Okay, now my hip's coming straight up and down. I can also rotate, externally, internally rotate these guys as I go, right? Really wiggle and roll at it. Perfect. Okay. Now if you find as though that's too intense, then you can also take this and put it on the wall. Okay, there's going to be less pressure here, so as I come down, yeah, we're going to start with the legs straight and just roll around using this hip and my shoulders as the brace. as I go. Just pausing and holding on those tender spots as I go. Perfect. And I can also lift up, come up, move around a little bit as I need to. Okay, so that's going to be even easier. Depending on where you are, how bad the areas are, it's going to be up to you to make these decisions for sure. I can't be there with you all the time. I can certainly be there when you need me to, but I can't be there all the time. Okay, so that's really good stuff. The other spot I'll talk about too is going to be that groin. So in the other foam rolling static stretching video that I've posted, I did definitely look at the hip, or the groin I should say, sorry. And that was looking like this. So my knee was parallel with my hip, and I'm rolling towards as I go. Now I've definitely learned in the last 6 months, you can see that I'm rotating my pelvis as I go. That's going to help, again, be active with these things. So I'm being very specific, or very general with the foam roller. Now if I do have a really tender spot, something else I can do is wiggle my hip, bring my foot up and down, and really find those really tender spots. Sometimes you can get into those inner quad muscles, the vastus medialis, or VMOs. And that's good too. Just releases some of that tension for sure. Alright, so that's good stuff. So again, the idea here is to improve mobility in the hip. So most recently, my most recent injury was grade 2 hamstring strain. Not a lot of fun, okay? It took me out of action for about 4.5 months. It was a long time. So what happened? Well, I went to physiotherapy, I went to massage therapy, and they kept saying, your hamstring's just totally buggered, your hamstring, your hamstring, your hamstring. Realistically, the hamstring was compensating. There was such a big old knot in my hip that I wasn't even realizing it was in my glute med. Glute med wasn't functioning properly because it just simply couldn't. It was too dried out, it wasn't hydrated enough, okay? There wasn't enough blood flow being stimulated to the area. So once I got this broken up, then the hamstring actually started improving as well. So yeah, definitely moving forward, we want to be able to strengthen the hips, we want to improve balance, we want to improve all these other things, but to get to those points we have to improve mobility, we have to get the joint actually moving properly. Like if you think about the actual knee itself, the knee is a hinge, right? It's coming up and down. It's not meant to do twisting. That's where you're going to risk the injury. All that height, the more extensive mobility areas are going to be the hip for sure. So the ankle is really mobile too for sure, but the knee is not. The knee is only meant to do this, not all this kind of stuff. So if this is stiff, it's not moving well. The back's going to move too much. The knee's going to move too much. The ankle's not going to move enough. So you're going to end up with all these different kind of components into it, right? Work the hips, get all of that nasty stuff out of there, and everything else will start to get better. You'll prevent injuries, you'll rehab other injuries, and you'll just start performing better on the field as well. I think that's pretty much it for today. Any other questions, feel free to contact me. I'll post my information at the end of this video for sure. You can find me on Twitter, at TomKingPT. You can check out my website as well, tkpt.ca. Once again, it's Tom King from tkpt.ca. I'm in Ottawa, Ontario. Have any questions, feel free to get a hold of me, okay? Thanks a lot. I hope you got something out of this. Take care.